Mastering Medicare. How do you do it? Well, there's a lot of different topics to consider. And in this episode, we're going to give you a checklist of items that you need to consider before or even after you choose your Medicare plan.
To learn more about how to secure your retirement and all the different elements you need to know, please subscribe to our channel and hit the bell so you'll be notified when we release episodes every Monday. We have helped hundreds of our clients gain clarity and get on the path to a great retirement. Now it's your turn. Let's dive in.
Welcome, everyone, to Secure Your Retirement Podcast, where our goal is to make sure that we share with you something of benefit each and every week. I will tell you right up front, I think we have a topic right now that I know is timely because we are very close to what is called open enrollment for Medicare. Now, I know there's two different sides of Medicare. There's the planning for it that I've never had it, and then there's I've already had Medicare, and I want to make sure that I am in the right plan. And so that's why we kind of are labeling this really kind of as a topics I need to think about for Medicare before and after age 65. Also, we're going to cover a lot of different little things. Kind of think of this as a checklist of things that you just want to kind of get in your head and think about. And again, this applies whether I'm coming up on Medicare or I'm already in Medicare. And so what we're going to do, though, to go into a lot more detail, and we'll give you information on this if you want it. We have a webinar that's coming up, and we're going to give you all the details at the end so that you can know exactly how to join that webinar, where we're going to go into detail about these Medicare supplements, how they work, what is the difference between them, and all those kind of good things. So really what we're going to do is cover three main topics. And again, think of this as a checklist of items. Remember that we have a blog written on this on our website, pomwealth.net. And we're really going to just work through these topics and say, okay, these are things I need to think about. So let's look at our main point number one, and this is around prescription drug plans. Lots to think about here. So, Merce, can you kind of give us our first little checkpoint here?
Yeah, under prescription drug plans, our first point is going to be you got to understand the prescriptions that you are taking. What are your needs as far as prescriptions go? Because drug plans have different coverage on different types of drugs. And so you want to make sure that we are selecting the right plan that is going to be catered to what you need for your health in the best manner. So that's looking over your individual medication needs. And then you want to look at on the plan side, they typically have a list of prescription drugs that they are going to cover. So you want to make sure that what you need is going to be covered by the plan that you are looking to, that you're currently in or that you're looking to switch to. And then one thing that is also very important is the cadence at which you need to get those drugs or refills done. So am I getting refills on a monthly basis? Am I getting refills on a longer term basis? So just three quick points there when we're looking at understanding our prescription needs.
And that segues real good into this next checkpoint, and that is comparing different what are called Part D plans. The reason we're talking about Part D is because Part D is the prescription part of Medicare. So there's one part of Medicare that covers hospitals. There's one part of Medicare that covers doctor's visits and those kinds of things. And then there's a Part D, and that is all about prescriptions. So now if you do what Merce said in the first point, now we go and we start looking and comparing the different types of plans under Part D that would cover my specific drugs at the lowest cost. So imagine, let's say I've got one person who maybe has got cholesterol, high blood pressure, those kind of things. Well, that's one type of medication. But what if I am dealing with other things? Maybe I've got rheumatoid arthritis and I'm taking something for that. Or maybe I've got blood thinner, or I've got other things that I'm taking. Now I can I've got my first part done at part that Merce just talked about. And so now I can start comparing those Part D plans. Because what you're trying to do is, again, compare in order to find what fits your specific needs the best. Because different ones what if you're taking no medications and you just want to say, well, I just need something in case it comes about? What are my highest risk that I might have? So think about it that way.
All right. The next point is evaluating your pharmacy network. So if you're taking prescriptions and you typically just go to your local CVS or wherever you get your prescriptions filled, well, that changes based off of the drug plan that you are in. So you want to make sure, I look at it from a cost perspective and a convenience perspective. Is the plan that you're going to be in or change to, does it have a pharmacy within their network that is convenient to your location, right? You don't want to get a prescription filled and then go have to drive 30 minutes to pick it up every single time, especially if you're doing this on a monthly basis. So convenience is going to be very important. A store that you're comfortable with and have gotten used to how they operate. And then there's also the idea of mail-in prescription online type of pharmacies. There's pros and cons of those. They may be lower cost, but you lose the convenience. You're subject to getting things done online. You're subject to processing paperwork online and then also waiting for it to be mailed to you. So I would evaluate what you're more comfortable with in that case. And ultimately, is it convenient enough for you?
All right. Our next one here is our cost analysis. What we're really looking at here is I got to think about plans and how much they cover. That's called premium cost versus my out-of-pocket cost. So sometimes people have the mindset that they want 100% of everything covered. Well, if you do that, you're going to have the higher premiums. So what you look at is to say, well, how much are my drugs? How much are my cost under the prescription drug plans? I might have a very simple scenario where my prescription drug cost is very low. I take a medication that's inexpensive. I can buy it with very little cost. Would I need to go then buy the most expensive drug plan out there? Again, this is all things that I'm just sitting down and I'm trying to consider it, because what we're looking at is what we call the coverage gap, or if you go into more research, they call it the donut hole. And Billy, what that is saying I'm trying to do an analysis, and in order to do analysis, I got to know what those things are. So this is just going to take a little bit of data for you to gather, and then we can actually start working those figures out. Also, there's considerations on my income. If my income is low, and sometimes in retirement, I have clients that because of their structure, although they might have very good assets, they don't have a lot of taxable income. Well, that could be to a benefit, and that's going to help us to determine what type of plan that we pick.
Okay, the last point under prescription drug plans is going to be annual reviews and making sure you take the time to review your plans. We've heard countless stories with some of our Medicare partners, as far as, I have a family that they've been on the same plan for years and years and years, and we had a conversation and they made a change, and it saved them $2,000 a year going forward, just because they took the time to sit down and take a look at it. So just like you would with anything else, with your car insurance, with your homeowner's insurance, with your retirement plan, with your life insurance, you want to be taking a look at those every year. Medicare and the plans around that, I think, is equally as important. So don't let those slide. And the other importance of it is you can make changes during the open enrollment period, which is coming up here in October. I believe it's October 15th through December 7th is the period. So a limited window for you to make that change if you want to make that change. So stay on top of that.
All right. Main point number 2, dental, vision, and hearing. So big topic. Merce, get us started.
All right. So dental, vision, and hearing, when especially if you're not on Medicare yet and you're working for an employer, you pick the healthcare plan that you want, and then dental, vision just kind of comes with it and you coast. Well, that's not going to be the case in Medicare. You're going to have to think about what type of dental coverage you need and find the appropriate plan for it. It's not an all-inclusive type of deal. And there's a lot of importance in dental coverage. A lot of times, your dental health can extrapolate into your overall health. So we don't want to ignore our teeth or our eyes or how we hear, because as we age, those elements can start to deteriorate at a rate that we don't want. So the importance, I believe, is having that coverage and taking care of that.
All right. Vision coverage, which is our next subtopic here. Basically, we got to look at things and say, do I want my eye exams covered? Do I want the coverage of my glasses or contact lens covered? And then what are my costs, their potential costs? And again, we're trying to compare this with, do I want to buy a vision plan, or do I want to just say, no, I'm going to cover my vision. I don't need to insure that. Because again, anytime I try to insure something, it might be that it costs more for the insurance than it does, or the same for me just to have my coverage for vision.
All right. The next point is under hearing coverage. The biggest item here, I think, is if you think there's a chance for hearing aids in your future, and being able to have access to those hearing screenings. Those are not cheap things. Hearing aids are expensive. The screenings for those are expensive. And so if that is a risk that you feel that you want to get covered, and it's a common thing, that you may want to consider looking into that, having enough coverage for that as well, rather than paying it all a la carte and then and realizing that it was way more expensive and it was much better option to have the insurance if we're going to go down that path.
All right, this leads us to our next topic, which is integrative plans. And this is where, when you're looking at all these items, there are plans called Medicare Advantage plans that kind of give you all those things as a part of their coverage. I want to give a big asterisk here, and that is, you also then have other things that you need to consider if you are looking at Medicare Advantage. So we are not promoting Medicare Advantage plans. What we're saying is, if you, depending upon all of your analysis, then you can make an educated decision. Do I want to do a true Medicare gap policy, or do I want to do a Medicare Advantage? And we're not going to go into all the details on this today. We will talk a lot more about Medicare Advantage and Medicare gap policies in our webinar, so you'll want to tune into that, like I said, and we'll give you more information on that as we get closer to the end.
All right. The final point here is doing an individual needs assessment. So just because your neighbor or your parents or a family member has a certain type of plan doesn't mean that that's going to apply to you. Medicare and healthcare in general is very individualized for a reason. And so doing that needs assessment is going to help you, just like we said earlier, understand your prescriptions, right? Before you choose that drug plan, understand your needs when it comes to dental, vision, and hearing, and how much coverage you actually need versus, well, you may not need as much as your parents do, right? So understand that, and you got to be forward looking as well, so that you are covered in case something does happen that you think is a possibility of happening.
All right, this brings us to main point number 3, which we're going to call Medicare Supplement and Medicare Advantage plans. That's what I was just telling you about before. So what we're about to do right now is almost a little part of an outline of what we're going to cover in the webinar. We're not going to go into these details. We're always just going to list for you these bullet points, just so we can say, here's what we're going to consider. So don't think about us answering anything right now. Just say, hey, this is kind of the outline, just so you can build anticipation.
So the point number 1 here is understanding the basics. Medicare, there's a lot that goes into Medicare, but then there's also supplements and advantage plans. And what is the difference between those? What they cover, what they don't cover. They're state specific, so you got to understand that too. If you're living in a different state or you just moved to a new state. So there's a bunch of nuances that we'll cover here in this upcoming webinar to help you get educated on the difference between the two, to help you decide what's going to work best for you.
Yeah, and that leads us to point number 2 here, cost considerations. You're going to have different types of premium cost and plan benefits between the two. So we're going to look at what a premium cost is. What is that? What does it look like between the two types of plans? What are my out-of-pocket costs between the two different types of plans? And then understanding the value of what I get from one to the other, and then my restrictions from one to the other.
Yep, which leads me into point number 3 is going to be the network restrictions. In network, out of network. Maybe you've had a family physician for the longest time and you don't want to leave them, right? You're going to want to understand what the plan covers, what considers in network, so that you can have the flexibility that you want from a choice of doctors to hospitals, understanding referrals to specialists. Those are big things when it comes to getting your annual visits taken care of. And if you need extra care, how that's all going to be handled.
And point number 4 here is additional benefits. Now, this is something that Medicare Advantage plans talk about all the time. Extra benefits like fitness programs, wellness services, assessing even additional benefits. Are they really valuable to you? And what do I give up from the Medicare Supplement plan to be a part of the Medicare Advantage for these benefits that can look flashy and good on one side, but is it the most benefit for my healthcare plan?
And the final point here is getting access to personalized advice. Just like you work with an advisor for your investments or a retirement planner to help you think of retirement and how that's all going to play out for you, there are Medicare specialists in this arena that we have access to. And you know, having someone that's able to take your list of prescription drugs, take your list of your health concerns and everything like that, and have someone in your corner to be a sounding board, I think is going to be the best way to help you make the best decision for you going forward. And then also, we can't forget that we have to reevaluate it at least annually and being able to leverage the resources that you have in front of you, I think is going to be great. Unless you just have that desire to become the expert that knows every little thing about every single Medicare policy, you're really going to want to partner up with someone.
All right. So that leads us down now. We've given you all these points to really want to tell you about this webinar we have coming up, because we think it's going to be extremely valuable. We're going to have a Medicare expert on that's going to walk us through all these plans. Merce and I are going to really interview them and try to say, hey, tell us about this, answer this question. We've gotten a lot of questions submitted, and you can do the same thing. So a couple things. If you would like to register for that, if you have specific questions that you would like for us to answer, then simply send an email to info, I-N-F-O, at pomwealth.net. And in your subject line, say Medicare webinar. And if you do that, list out any questions you want to make sure that we cover. Anything at all you want to know about Medicare, list it. We'll try to make sure that we address it in the webinar. And then also they'll reply back to you with a link for you to be able to register for the webinar. So again, that's info at pomwealth.net, and we'll be glad to get you on that. Absolutely no cost. You'll be very, very educated. You might want to tell your friends that have been asking about Medicare as well. This is going to be a free open webinar just to give information out there about Medicare. So we hope that we know we went through a lot. We know that we've covered a lot of different material. You can always go to our blog page and look back over these points. We feel free to also come to the webinar. We hope you have a great week. We'll talk to you again next Monday.
We hope this video has given you some confidence and clarity as you plan for a worry-free life in retirement. But what else do you need? We have created a complimentary video course called 3 Keys to Secure Your Retirement. This video walks you through step-by-step what you need to do to get ready for retirement. You can also check out our podcast called Secure Your Retirement. You can subscribe below.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.